Hi, everyone. It's Tran Bowie. Thank you so much for joining us today. So the pandemic has left a lot of people at home and many unable to get the proper medical care, and that includes physical therapy. Benchmark Physical Therapy is now open for business again with safety precautions, and this is a huge relief to people who've been dealing with pain. So joining me now, social distancing and with safety precautions with their masks, our Regional Vice President of Sales, Tanya Burrow, and Regional Vice President Spencer Lasky. Thank you so much for joining us. And I do appreciate that you take this very seriously.
Absolutely.
Yeah, so let me just start. Benchmark is actually one of the largest physical therapy facilities in the country. I just want to look at the numbers, 760 clinics in 27 states. And we're very fortunate to have many of them, not just in the Roswell area. There's actually one clinic that's about 5 minutes from my house, so it's perfect, but throughout the Atlanta area as well. So Tanya, this had to be a huge hit early on, especially when things were closing up. Tell me how business looked and how the quarantine affected Benchmark.
So it has been, and being here from the ground up and watching a company fall to its knees, it's been really tough. It, in the beginning, we watched it and we watched people obviously becoming nervous to come in the clinics. And so we started to take a pretty big hit. Clinics, we had to close quite a few clinics, and we just had to stand by and hope that people would feel comfortable by coming back again, and they are now, so thankfully. But it's been a really tough time for us.
Well, I'm glad to see you're back, and I think a lot of people realize they can't live without Benchmark and the service that you provide. So Spencer, I was actually able to visit you at one of your clinics shortly after it reopened again. So I just want to have you walk us through the safety precautions. So what happens if you want to make an appointment?
Sure. So when you schedule, we screen you for any symptoms and make sure that you're healthy to be around other folks. We're not trying to have anyone in clinic who's actively ill. And if they know that they aren't feeling well or have been exposed, then we ask them to wait to come in until we have the all clear from a physician. So other than that, you come in, we have you hand sanitize or wash your hands, we take your temperature. We have social distancing precautions and scheduling accommodations in place. There's plexiglass up at the front desk to make sure that there's a barrier there. And we're following and exceeding the CDC and WHO guidelines for cleanliness and sanitation on a daily basis.
Yes, and also, so people are not comfortable coming in. Are you still offering virtual?
Absolutely, yeah. We're offering visits via telehealth. It's a video platform a lot like the one where we're talking now. It's been heavily utilized. And I've had a good experience in utilizing myself. People get a lot out of it. And there's some real positives that surround the use of telemedicine if you're not able to come in or unwilling.
So Tanya, this is a profession that is very hands-on. You're working with patients, and a lot of times you do have to touch them during the physical therapy. So how is it looking right now?
Absolutely. We are taking all precautions. Like Spencer said, all precautions. We are social distancing. Him and I are 6 feet away from each other, wearing masks, one-on-one treatment. We will take time in scheduling, making sure that we are not scheduling on top of each other and that everybody is getting one-on-one treatment in their care, and that we are social distancing and taking every precaution possible.
I know, and I know that has to be difficult. Like, you are having to take all these extra steps, but I do commend you because people want to feel safe. Spencer, I want to talk about what has been happening during the quarantine. We are seeing more people at home. Like for me, I'm sitting at a desk all the time. So you have people who are sitting around a lot, whether it's for work or watching TV. And then you have the people who are maybe exercising more or doing more physical activities that they normally wouldn't do. So are you seeing patients come in who have either not been taking care of themselves and doing all their physical therapies, or the ones that are actually have new injuries because of all the new things that they're doing?
Yeah, there seems to be folks that are more sedentary during quarantine and have taken up baking. And then you have people that are very determined to have a transformation during quarantine and have upped their activities significantly. I think in either case, you have issues that surround those things. You know, we don't have an ICD-10 code for quarantine-based injury quite yet, but I think, you know, the more people do unguided, the more they change what they do drastically. It sets up a climate where they can sustain an injury or run into new problems, or maybe they're wanting to address something for the first time. And in any case, it's a great time to come and see us. You know, the quarantine and COVID-19 have been impactful on people in a number of ways, and we can certainly help folks through this time.
So Tanya, let's talk about a PT or a physical therapist. Who needs to see one?
Oh, gosh, I mean, I believe that everybody needs to see one, especially during this time. Staying strong physically and mentally is more important than ever, and conditioning. And so, I mean, we treat everything from headaches to, you know, neck, back. I mean, you know, from the head to the foot, everything. So any type of pain, vestibular, dizzy, you name it, we treat it from head to toe.
Wow. And we do have a question coming in. How often should you see a physical therapist?
Sure, I'm happy to take that. So Lisa, depending on your problem, definitely one time first, and then let somebody examine you, give you a sense of what's happening. In Georgia, physical therapists with over 2 years of experience or residency training can see you directly without a referral, and then determine and screen you on whether or not, hey, this really needs to be looked at by a physician, or let's start treatment and see how you do over 21 days or 8 visits, whichever comes first. And then that physical therapist will help you come up with an individualized plan based on your issue.
And some people may need to see a therapist for life, right?
Yeah, I mean, this is my 10th year in practice, and I have several patients that I've been treating since my first year. And it's like when a friend comes back to see you under unfortunate circumstance, I'm sort of like the person they don't want to see, but definitely work hard to put a smile on their face and address the issues and get them back to doing what they love.
And Spencer, you are not just the regional vice president, but you're also a therapist. And Tanya mentioned some of those things, but can you list a few of the injuries that you treat?
So I've been very fortunate. Yeah, I've been very fortunate in 10 years to treat a wide array of neurological and orthopedic problems. It is literally from brain tumors to bunions. So some of the things that we see more commonly in clinic are neck and back pain, shoulder pain and knee pain, post-operative patients for various reasons. We do see a lot of vertigo and dizziness, ankle sprains. So, you know, anything that comes to mind on those most common are what, you know, you're going to see. And sometimes pain feels isolating, and then you get to clinic and you're like, oh, everybody has my problem. And so we can help, certainly.
Okay.
And let's add to that. Can we add to that too? We also treat women's health issues.
Oh,
yeah.
Okay.
That's something that people forget a lot about when it comes to physical therapy. So
yeah, we have specialties in lymphedema, pelvic health. So it runs a gamut in terms of what we offer and what's available for treatment.
Oh, wow. Okay. So I did not know that. I'm so glad you mentioned that. And that helps a lot, because sometimes we're dealing with a pain and we don't know who to call. So we should just call you and just run through all our ailments. Ray Baker has a question right now. He is asking, what are some of the exercises or therapy you can do at home for a strain between your biceps and triceps before coming in to see a therapist?
So without examining somebody, it's very difficult to provide guidance. We would at least want to set up a time to come and see somebody and evaluate them so that we can permissibly offer that advice. We cannot offer advice without at least examining somebody, because we have to determine what the issue is specifically. I do appreciate that, but Ray's more than welcome to set up an appointment at the nearest location to come in person or via telehealth.
And that's
we also offer, real quick too, we also offer a free screening. So if somebody has an ailment or not sure what's going on, they can come in for free and we can evaluate and then, give them a treatment based on what we find.
Okay, Ray, look up the nearest benchmark to your house, because I would love to know the answer for that. And so you do offer and you do provide like at home exercises as well.
Yeah, providing a home program is definitely a part of what we do. Generally, every single patient is going to be sent home with some activity to do related to, their pathologies. I like to kind of orient people to the fact that if you have an active problem, it's happening 24/7. And if you only see us 2 or 3 times a week, that's 2 to 3 hours you're getting treatment for it. Well, all those other hours of the week, that pathology is working against you if you're not doing your home program. So it's vital to the recovery process.
Okay. And should you see one if you're not in pain, if you're just really active, or if you're an athlete?
Proactive approach to wellness is beautiful, and we do offer wellness. You don't have to have something wrong to come in. We can still evaluate and offer tips on sort of what injuries you may be prone to based on an examination, and help guide you based on your activities and what you choose to do to prevent injury that maybe others have suffered doing the same activities. So that's a beautiful approach.
And Tanya, what are some of the wellness programs that you have?
I'm going to let Spencer touch on that one. He's more versed in the programs we offer because he's a therapist.
Yeah. So I have some wellness patients. We work on strengthening and reaching basically non-functional deficit goals. So what that means is, let's say you're trying to perform at a certain level, or you're training for a race, or you're training for some sort of competition, or you have sort of ongoing pain that hasn't responded and your insurance will no longer cover it, then we're maintaining your current level of function. And so then we can provide interventions. I don't dry needle myself, but with a referral, we can offer dry needling only if that's something that someone's looking for. And there are a lot of people that seek that out.
Okay. And I want to talk about just patients with COVID-19. We're seeing a lot of patients come in and they're having, not just respiratory, but, also physical problems as well. And so a lot of therapists have actually been going into the hospitals and helping the patients, like once they get out of ICU. Could one of you talk about that and how that has affected your business as well?
Yeah, so we're not seeing a lot of post-COVID referrals yet, but there have been some. These folks come in and they have deconditioning physically, and so they are short of breath. They're not able to actively move and don't have the endurance they did prior to the illness for one reason or another related to the virus. And so we use graded increased activity to help build them back to their prior level of endurance and performance. And there are evidence-based protocols for sort of post-COVID rehab that are in develop now, and we're implementing them in real time.
So Tanya, you mentioned it earlier, and which is so important. I think what the quarantine and COVID-19 has reminded us is our health, whether it's physical, mental, emotional, is so important. And it's really important at this time to take care of ourselves.
Yeah, now is the time too, especially while we do have more time and more people are working from home. We can custom tailor, home exercise programs, building your immune system up, staying fit. If you're in pain, we can do telemedicine, 101, things that we have not traditionally been able to do before. So there's no sense in not taking care of yourself, especially while we have more time. It's more important than ever. Like I said, physically, mentally, taking care of those things right now.
And on the business part of it, there is a chance that this is ongoing. There's a chance that we might be forced to go back into quarantine again. Tanya, are you looking at those things? How is Benchmark approaching that and being prepared for that?
So we are. We look at those things daily. Probably hourly. I think all of us are a little scared with the numbers going back up, but I can assure you that we are on the forefront of keeping everyone safe, making sure that they feel comfortable coming in the clinic, that we do everything to take care of everyone that comes and walks through our doors. So, and again, if they don't feel comfortable, there's a telehealth option. So
I know, I think, we hate to think of it this way, but this quarantine has actually opened our eyes to new ways of doing everything. And that includes physical therapy. So Spencer, it's just this whole year, this whole event has been so uncertain. And I love how you guys are just learning to embrace it and provide this service, because it's dangerous for some people to just completely stop their therapy, or not go in to see a doctor and just deal with the pain. So because we don't know when this will be over, Spencer, some advice for people who are at home now and they're just uncertain about whether to come in and see a therapist.
Sure. I mean, the best way to mitigate risk outside of your home is to wear a mask, and masks are required for all associates and all patients at all times while inside the clinic. And we're, distancing people. We're spreading them out in the clinic as much as we can, to exceed the guidelines. And, the best thing to do is for people to be washing their hands and then wearing a mask when they're out, educate themselves on sort of what the most common modes of transmission are, and to ask questions, right? To reach out to the provider and say, hey, I have this, and this, are there accommodations that can be made for me? Is it a good idea for me to come in, and to talk to their doctor? In a lot of cases, the longer you have an issue, the longer it takes to address in therapy. So the sooner someone can get in safely or start therapy via telehealth, the sooner their issue will be addressed. So, that would be my recommendation to, my friends, my family, my patients, anybody who asked. And I certainly practice those things as often as I can.
Well, we appreciate it. Thank you so much. And I have, I think a lot of people are concerned. I have been in your clinics. I felt like there was this bubble around me. So you guys definitely are doing the right job of protecting us and making sure everything is clean and available. And I was the only one in there. So you're making sure that patients are spread out. So thank you so much. I'm hoping that all will be well and that you'll continue to operate. We do appreciate Benchmark in our community. And as you both said, let's take care of ourselves. Thank you.
Thanks so much for having us.
Thanks for having us.
All right. Have a great day, everyone.